Good afternoon, ladies and gentlemen of the media. The Premier, the Honorable David Burt, JP, MP, will give a COVID-19 update.
Good afternoon. Today I'm joined by the Minister of Health, the Minister of National Security, and the Minister of Education. My remarks today will cover my daily update regarding test results for COVID-19. I will then discuss a few matters related to the upcoming state of emergency and the existing curfew around the shelter-in-place measure which has been put into place by the Governor of Bermuda commencing on Saturday, and also the Minister of Education will give an update on the ministry's plans for students next week. Regarding our situation with testing, the government did receive additional test results today. Out of the 36 test results that were received today, there were 3 positive cases for COVID and 33 negative test results that were received. This means that the confirmed positive cases in Bermuda now stands at 35. Out of those 35 persons, it is important to note that 11 persons have recovered. Out of those 35 persons, there are 4 persons now that are hospitalized, and all of those persons are listed in stable condition. So again, we have 35 total cases. There are 11 persons that have recovered, 24 active cases, and out of those 24 active cases, 4 persons are hospitalized. Did I missay something, Fiona? Okay, got it. Out of the cases, 22 overall of the 35 were reported, 11 were local transmission, and 2 were under investigation. Out of the 3 new confirmed cases, 2 of them were imported, and 1 is under investigation. 1 of the confirmed cases arrived in Bermuda on the British Airways flight on the 18th of March. The other arrived on the Delta flight 561, on the 18th of March 2020. If you were on either of those flights on the 18th of March, your quarantine period ended yesterday, April 1st. If you are feeling fine and have no symptoms, continue to either practice social distancing, remain in your house, and observe the self-quarantine guidelines. If you have respiratory symptoms, such as a persistent cough, or even a mild fever or a sore throat, please contact your doctor. Alternately, you can, prior to contacting your doctor, you're welcome to go to the website as listed here, coronavirus.gov.bm, and look under resources, where you will find a symptom checker which has been released by the Bermuda Hospitals Board, so you can look to see whether or not you may have or have the symptoms of the coronavirus. When you talk to your doctor, explain that you are on one of the mentioned flights and you would like medical guidance. Please, as I say all the time, do not go to your doctor's office or the hospital. Call ahead. Currently, there are 1,206 persons that are under self-quarantine with public health supervision. A review of our overall testing numbers states that out of the 261 tests that we've conducted, as we noted, 35 were positive and 204 were negative. The rest of the results are pending results. Regarding the curfew, I'm pleased to state that the vast majority of people in Bermuda understand the importance of the curfew and are in their homes by 8 o'clock p.m. The Bermuda Police Service today reported that there was 1 curfew breach last night, and that person was detained and held at the Hamilton Police Station and released after curfew. It is important to note that the exemptions can be found for anyone who's requesting an exemption for curfew at forms.gov.bm/COVID-19/curfew, or you can just visit the coronavirus.gov.bm website and you will find the link to the exemption request form there. Yesterday, I announced the government would be instituting a shelter-in-place order for the 14 days from the 6 a.m. the Saturday, April 4th until Saturday, April 18th. I will reiterate why this measure is important for the lives of each person who lives in Bermuda. COVID-19 is a deadly disease. We have seen how it has devastated towns, cities, and countries around the world. In Bermuda, we have the ability to flatten the curve and slow down the transmission of the virus by reducing our contact with each other. The virus, as you know, is spread from person to person and by people touching surfaces where the virus is present. This is the reason why it is important to maintain your social distance and to practice the good hygiene that we have spoken about. Minister Keynes has spent the bulk of this afternoon answering questions that people have regarding the shelter in place and how it impacts their personal circumstance. Though we will have the ability to answer questions at the end of this press conference regarding specifics, I'm going to ask for the patience of the public as the Attorney General's Chambers is finalizing the regulations, and it's important to note that though the regulations are requested by the Cabinet of Bermuda, the Governor of Bermuda must issue those regulations, and until those regulations are issued, nothing can be considered official as it is under the remit of the Governor in which to issue. So we will wait for the finalization of those regulations. What I will note, however, is that shelter in place will be difficult for many persons in our community. The added stress of reduced incomes, anxiety surrounding the coronavirus, and the inability to leave people's property creates extra pressures for many families. It is important to note that support has been put in place to help families during this time. The government has established clear priorities for ensuring that vulnerable persons in need that are in our community have their needs met. Many partner agencies are working together: churches, nonprofits, and government departments. Resources are available to deliver food, and there are services for seniors. Shelter is available for those in need, and for those persons who may be unfortunately experiencing domestic violence, help is also available. Approximately 14 food services and feeding programs have been put in place, and they are providing over 3,000 meals a day island-wide. Regarding our seniors and our nursing homes, many of Bermuda's most vulnerable live in seniors' homes around the island. There are 21 facilities, 19 of them which are private, which serve a total of 392 seniors. Funding from the Bermuda Emergency Fund, which is administered by the Bermuda Community Foundation, has been used to buy supplies, personal equipment, install Wi-Fi, and get more phone lines into the nursing home facilities. If anyone has a concern about a senior, or if you're a senior that needs help, you're welcome to contact Dr. Claudette Fleming at 747-7525. Before this COVID-19 crisis emerged, a team of nonprofit and public experts met, including representatives from Vision Bermuda, Meals on Wheels, Aging and Disability Services, the Bermuda Health Council, which has oversight and licensing responsibility for seniors' homes, Age Concern Bermuda, and a consortium of public and private nursing homes. Each organization went back to their list of most vulnerable clients. Many seniors were contacted directly. Their needs were assessed and addressed with the assistance of Age Concerned social workers. Aging and Disability Services also is conducting wellness checks on seniors around the island. These organizations are on standby to address short-term needs of those seniors as they arise. For those members of our community who can help make a difference by making a financial contribution to the emergency fund, please go to www.bcf.bn. All funds will be used to support the identified priority areas for our most vulnerable. On to the issues of domestic violence. Unfortunately, what happens when you have curfew orders or shelter in place, you will unfortunately see an increase in the risk of domestic violence. Please note that if you are in a domestic situation and have concern for your safety, contact the police or call the Center Against Abuse at 292-4366 or their 24-hour hotline, 297-8278. The government does not want anyone to remain in a vulnerable position where you may be subject to domestic violence. And I'd like to speak today to state that if you are in that situation, we can make sure that provisions are made for you. We do not want you to be in a situation where you may be abused, and if you need help, please call, and the government will make sure that we can assist you in your particular circumstances. Earlier today, I saw the long lines at the grocery stores. I want to reassure the people of Bermuda that grocery stores will remain open during the 14-day shelter in place. Pharmacies will be open, as well as gas stations. There is no need to buy in bulk. There is plenty of food on the island, and there is enough for us all. I ask and remind persons that social distancing is particularly important, and the Minister of National Security, in conjunction with our services, is going to look what assistance may be provided to help to make sure that we can have persons maintain adequate social distancing. But the best advice is buy what you need to buy and do not buy any more. There is enough for everyone. And to remember that during the 14-day shelter in place, there will be the opportunity to travel to a grocery store within limits of which will be laid out in regulations. The government has also been focused on bringing Bermudians home who have been stranded in the United States, and our students who are stranded, some in dire conditions in the United Kingdom. Working with a local travel agency, who have generously secured a charter flight by Delta Airlines, and the travel agency is Travel Edge. A flight is being organized to bring travelers who may be stranded in the United States from Fort Lauderdale, Florida to Bermuda. There is a cost for this flight. However, the more persons who take advantage of the flight, the cost could be reduced. If you have a loved one in the United States who needs to return home, direct them to coronavirus.gov.bn to complete the Returning Bermudian Residence form to add their name to the list. It should be noted that priority, both in London and in cases from the United States, are for persons who are students or vulnerable persons. Then it goes to people who are ordinarily resident in Bermuda. Persons who have moved overseas and are not normally resident in Bermuda are lower on the priority list and may not be given seats on the flight, given that there may be space constraints. Whether travelers are arriving from London or the United States, once they arrive in Bermuda, they will be mandated to enter a government quarantine facility for 14 days. The Minister of Health has signed a new order that requires this, and our government has secured a facility with more than 300 rooms to meet these required quarantine demands. As I've stated previously, we have an obligation to help bring home every Bermudian who is stranded overseas by circumstance far beyond their control. And as I've stated previously, some of the stories of which you are hearing that I've heard are not good. I just got off the phone with Ms. Kimberly Durant, who runs our London office, and we have students that are literally calling her office in tears because there are no services and support for them as their universities are shut down, and they are very literally the only person that is left on their university campus. The fortunate thing is that most of those students will be home on Monday. I've heard stories of our seniors who having retired, have made the decision to vacation and have ended up in a city where they hadn't planned to stay in, expending money on flights, hotel rooms, and food that they had not budgeted for. These are our people, and I'm happy that we continue to work with Government House and the Foreign Commonwealth Office to resolve their dire situations. Earlier this week, I spoke about the plan to get hospital workers who usually rely on public transportation to and from the hospital. There had been a delay in starting this service. However, the Department of Public Transportation Management, the Bermuda Industrial Union, and the Bermuda Public Service Union officials and the Occupational Safety and Health Committee members met with Bermuda Hospitals Board's Chief of Medicine and expert on infectious diseases to clarify the requirements for personal protection equipment, hygiene, and social distancing on the buses under COVID-19 regulations. The Department of Health Healthcare professionals were also present to advise on personal protective equipment and COVID-19. The bus drivers now have an understanding of the risk exposure and the precautionary measures required to ensure the safety of employees and passengers on buses. Follow-up actions are ongoing. However, the team at DPT has made sufficient progress to safely resume the KMH bus service starting tomorrow. I thank everyone who has worked to make this service possible so our healthcare workers can get to work. Now, I will end with some good news. The Bermuda Post Office today confirmed that pension checks for seniors will be delivered tomorrow. Also, the Minister of Finance confirmed to me earlier today that payments have been processed for 1,142 persons who were approved to receive benefits under the unemployment fund. Again, 1,142 persons. Those payments were processed at our local banking institutions today, and there will be another run that will be performed tomorrow. The Minister of Finance has informed me that the persons whose payments were run out of that fund were paid for the first 2 weeks of their benefits, not just 1 week, but the first 2 weeks of their benefits. I will close my remarks today with my customary thank you. Thank you to Bermuda's public health professionals and healthcare workers around the island who are on the front line every day. Those are doctors, those are nurses, those are lab technicians, those are the ones who work in support, persons who clean the hospital, orderlies, the persons who are preparing food, and otherwise. Whether you are persons who are working picking up garbage around the country, whether you are transporting our people to and from work, whether you are on the streets making sure that we maintain our curfew as a police officer or regiment officer, I, on behalf of a grateful country, give you our thanks. To my fellow Bermudians, as I say all the time, we must use this time to define who we are, to do what is right for ourselves and our country. We are going to have to dig deep and be strong as we prepare to endure 14 days of sheltering in place. But I have no doubt that we can do it, and if we do it the right way, it'll be the last time that this country will have to do it. Thank you, and with that, I will turn the podium over to the Minister of Education. Minister?
Good evening. I would like to share information with our education family and the community concerning what is expected of our students and staff during the weeks of April 6th and April 13th. I'll first start with the week of April 6th. We will be extending students' spring break for the next week, April 6th through April 9th. However, while students are on an extended spring break, we encourage them to find time to read and to engage in some form of physical activity every day in their respective homes and yard spaces while Bermuda is adhering to the shelter-in-place order. As all public officers are still expected to continue the provision of government services during the 14-day shelter-in-place, principals and school staff will be working remotely and planning for the reopening of schools. This planning is critical because when our schools reopen, the schools will not jump back into business as usual. Instead, schools will commence with a recovery period before they transition into the regular school schedule and routines. We recognize that our staff and our students have been impacted by this pandemic, and therefore we're taking this approach to have a period of transition to normal school schedules and routines. The main purpose of having a recovery period is to restore the normalcy that had prevailed in school before this crisis. The decision to include a recovery period from our schools is aligned with research and international best practices. During the recovery period, which will be implemented the first week when schools reopen or the week of April 20th, schools will have revised schedules, students and staff will be able to wear casual clothing, and there will be a focus on activities to help staff and students to gradually transition to the regular school schedule and routine. These activities will include reteaching and reestablishing routines, reviewing the expectations for learning, preparing students to recommence the learning for specific subject areas, provide stress management during class time, attending to the social emotional well-being of our students and our staff, providing supportive services, conducting safety audits, introducing new environmental and health protocols, reorganizing classrooms and buildings to incorporate any new environmental or health protocols, assessing the emotional needs of students and staff, holding regular debriefings with staff, evaluating the progress with the recovery phase, determining lessons from the crisis, and communicating with families. I'll now move on to the expectations of the week starting April 13th. We will suspend remote learning strategies during this week. However, students will be provided with a menu of activities from which they can complete each day. We recognize that all of Bermuda is required to shelter in place, and that continuing with remote learning strategy may present additional challenges and stress for families and households. Principals and school staff will carry out individual planning to ensure that they are prepared for the implementation of the recovery program once school opens during this week. At this point, let me share in the preparation of our school buildings. It is important to make clear that there is no evidence that any student or teacher may have been affected by the coronavirus or that there has been any contamination in our schools. The Department of Education, however, understands it's critical to maintain a clean and sanitary learning environment for students, teachers, and principals. Therefore, out of an abundance of caution, deep cleaning and disinfection protocols were developed by Dr. Kent Simmons of Bermuda Water Consultants Limited so that we could achieve this. As such, the deep cleaning commenced the week of March 23rd following these 4 steps. 1, deep cleaning of all classrooms and other activity meeting rooms throughout the school. 2, disinfection with bleach-based disinfectant. 3, a final and specific cleaning of high-touch surface areas such as door handles, handrails, desks, countertops, telephones, toys, water fountains, playground equipment, bathroom toilet levers and dispensers, etc. And finally, school inspections using a checklist and sign-off process. There are only 3 schools remaining to be deep cleaned, and this will occur by the end of day tomorrow. So at this point, I want to recognize the work of our school custodians. They have been diligent in following these protocols and undertaking this deep cleaning regime in preparation of receiving our students back to school. Our facilities team is now conducting inspections of the school buildings using this checklist. We appreciate the work that they are doing on behalf of our children to contribute to a safe and healthy school building. In closing, I encourage our education family to continue to review the Ministry of Health's official webpage of www.gov.bm/coronavirus for information related to COVID-19. Thank you.
Any questions?
Good evening, Minister. Prayer. When you saw the grocery stores this morning, what was your reaction?
It wasn't a question of reaction. I just want persons to note that I don't think that's the best and most productive behavior. The fact is that we are trying to minimize distance between persons. The Minister of National Security is going to be giving additional guidance towards grocery stores. The fact is that they are open and they will remain open during the period and points in time of our 14-day shelter in place. So there is no need to go. And the only other thing that I would remind persons is that the major grocery store chains, which I'd like to thank, and that is Marketplace, Lindo's, Arnold's, and Supermart, which I think is an operation here and also in St. George's, have offered to extend the regular 5% discount, which takes place on Wednesday, to all of the 14 days that the shelter in place will be in effect. And so given that case, persons who were shopping today would not have been able to take advantage of that, but during the shelter in place they'll be able to do so. There'll be limits, certainly, but this is not a need to run out and stock up and to try to turn the visits to the grocery store into a social outing and gathering. The other thing, which should be important to note, is that, as the minister had said yesterday, that persons who are traveling towards a grocery store during the shelter in place should not be traveling with multiple people in their car. I don't want to get to the place where we are in other jurisdictions where there's only one person allowed in a car at a point in time. But the fact is that we're trying to minimize contacts with each other. That is the very purpose, so that hopefully by the end of this period, I can come here and say that we have 0 test results that are positive. And that's where we are trying to get to. So from that particular perspective, I didn't feel any particular way. I just want persons to note and understand that you don't have to run out and get it, because it's not as though if the grocery stores are going to be closed.
With regard to the BA flight, how many students or vulnerable people have signed up for that? And for you to hear some of their stories, how heart-wrenching is it?
Well, I mean, it's heart-wrenching when persons who find themselves in a situation that is of no fault of their own. And so, if you're talking to Ms. Durant, I got off the phone and she's talking about how, she has students calling her office crying every day, wondering how they're going to get out of the present situation they're with. They have no family out there, their food's running low, et cetera. It is a difficult situation, certainly, but I'm pleased that we're able to get them home. I don't want to go with numbers because they're still in flux between the other overseas territories and what we have. But the unfortunate reality is that we are prioritizing the list. There's a large number of persons who have asked to be a part of it, and there is a limited amount of space on this particular flight. So we're looking at the ones who don't have other particular resources, don't have friends, don't have family, are in their dorm rooms, or seniors. Who are actually out there that are stranded particularly. But that information is going to be communicated to all persons over the next 12 hours. I got off the phone with Ms. Durant, and they will get that information shortly.
I listened to Minister King's talk this afternoon, and he had a very good point that some people have been asking about couples who are separated or divorced and dealing with custody of children. I thought it just might bear worth repeating tonight for a larger audience.
What I want to say is that we are finalizing the regulations, and once the regulations have been finalized and they are promulgated, we'll be able to speak with certainty and specifics. I don't want to possibly put out the mixed message. I've just received an email from the Attorney General's chambers. The ministers and I are going to go downstairs and review it. But the points of which you noted in where persons are in shared situation is something that has been considered, and we're fine-tuning precisely what it is so we can make it clear.
For the bus drivers, what's the PPE that they're going to get?
The PPE which has been given are, I think it's gloves.
Okay.
Gloves and hand sanitizer, sorry.
All right. Thank you very much.
Thank you, Melissa.
Thank you. With regards to, you said there was, I think, pardon? I think you said there were more than 1,100 people who'd been approved for the unemployment benefits payments. Are you able to give a figure for how many people applied in total?
I don't have that figure with me. I can try to get that figure in the future. I don't have the figure on how many did apply. I had the figures a couple of days ago, so I put in my statement that 800 persons had completed applications, but clearly more persons had completed applications if we were able to process 1,142 payments today. I just want to give tribute to the Minister of Labor, Community Affairs and Sport, the Minister of Finance, as well as the team that is inside of the Department of Workforce Development, who built this program from scratch to enable us to deliver this relief directly to people's bank accounts today.
I think this may be a similar response to what you've just provided, but with regards to laundromats over the course of the shelter-in-place period, do you know if they're still going to be available?
There is the consideration of laundromats. Laundromats are not on, as I gave my particular statement yesterday, the list of facilities that are open. Laundromats do create where there are multiple families from multiple different households in the exact same enclosed space, which is precisely the type of things of which we are trying to particularly avoid. The best advice that I would say is for persons that use or need to use a laundromat, that they'll try to get their laundry done as much as possible. The Minister of National Security is live to that particular issue, and we're going to work through to see what possible accommodations may be made during the time and period. But I would urge persons who use laundromats to try to get their items that are done in advance, and that is the precise reason why we try to give as much notice as possible for those particular situations. It is very important. We're trying to keep the social distance, so if there is any possibility of transmission, they're reducing it, and the opening and having persons be able to use laundromats will, given that there's multiple different households in the same place, that will, small enclosed space, touching many of the same particular items will defeat many of the purposes of what we're trying to achieve with social distancing and this shelter in place.
I think there were some breakdowns in terms of sex and age range of the positive cases. Is it possible to give even a bracket of the age range of the people who are in hospital with regard to COVID-19?
I'm going to say this. Can I say? Okay. The Minister of Health would rather not disclose that information to the persons that are in hospital. What I will say is that I'm not going to give their specific ages, but the persons who are hospitalized are not young people. Yeah.
Thank you. And I think this is probably the last one. I know we have some shipments expected, I believe, towards early next week with regards to PPE, kits, masks, etc. Are we confident that what we have at the moment sees us through until the next supplies come in?
The supplies are due. Okay. All right.
There are some supplies that are due on the 6th of April, some of the PPE on the 6th of April, and then there's a further order of supplies that are due a couple days later. Next week, one is by courier and one is on the BA flight that the Premier mentioned that would be returning some of the students. However, you probably would have noted today in the United States, they effectively embargoed exportation of all PPEs. So that will present a challenge. However, as I've said previously, we are looking to source PPEs from Europe as well as other countries within the region. Southeast Asia,
what we have at the moment is enough to see us through until like the 6th of April?
That is the hope. However, again, we are recognizing that there will be a shortage eventually. However, having said that, recognizing that that may come, in anticipation of that, we are ensuring that we source as much supplies as we can from Southeast Asia as well as Europe. So we're comfortable that we have sufficient for now, but we are continuing to source for future needs.
Understood. Thank you very much.
Okay.
Thank you very much.
That's it. Good. All right. With that, I thank everyone for their attention. We will be giving an additional update tomorrow. There will be additional information which will be coming up from the government regarding the specifics of the shelter in place. I'll just remind everyone to remain calm. Grocery stores will be open with discounts throughout the period and point in time, and we want persons to get themselves, use this time to prepare themselves and to get ready and to avail yourselves of all the services the government has to offer. If you need any particular information, I would strongly suggest that you either go to the website coronavirus.gov.bm or sign up for the government's WhatsApp. Thank you very much.